Hello, welcome to South Today. I'm Sally Taylor. The headlines tonight: a shake-up of health services in Dorset has been given the green light. Millions in investment, but Poole loses its A&E.
What are people who live quite a way out going to do to get to A&E? By the time they get to Bournemouth, they could be dead.
It's a huge investment in NHS services in Dorset, but is £147 million enough to convince people that a reorganisation of hospital services will result in better care? Campaigners against the plans, which have now been given the go-ahead by the Health Secretary, say they still have reservations. The county's two main hospitals, Bournemouth and Poole, will be turned into specialist centres with one A&E department between them. Well, Steve Humphrey is in Bournemouth for us tonight. Steve, this is still controversial, even though it's going ahead.
Yeah, very controversial. These reorganisation plans were first announced back in 2015. Would you believe? Some campaigners still not happy with the outcome. The NHS panel that reviewed the plans is now urging hospital managers and protesters to have a more constructive relationship in the future.
Poole A&E, say Poole A&E.
It's the plan to shut Poole's A&E department that's been one of the most contentious parts of the hospital shake-up. The outcry wasn't just from people in the immediate area, but from those further afield, in places like Wareham and Swanage, who say they fear the consequences of longer journeys across the conurbation to Bournemouth.
I think it's absolutely appalling. Boris Johnson has said we're going to get 40 new hospitals. Why are we losing all our emergency services from Poole? It makes no sense at all.
Dorset's clinical commissioning group wants to transform services because of increasing demand and financial pressures. The reorganisation will trigger an investment of £147 million. There'll be a new accident and emergency department at the Royal Bournemouth, along with a new women and children's unit. Poole Hospital will be redeveloped to become a centre for planned treatment, with 14 operating theatres.
When we come to have a combined emergency department for the whole of East Dorset, we will be able to have 24/7 consultant presence in our emergency department, and that can only be safer for people knowing that they are being seen by the most senior member of staff in control of their care.
As part of the transformation, more services will be provided at 13 community health hubs. The aim is to substantially reduce the number of people who have to go to hospitals for outpatient appointments.
Well, despite all of those assurances, some people in Dorset are still very upset at that decision to close A&E in Poole.
What are people who live quite a way out going to do to get to A&E? By the time they get to Bournemouth, they could be dead.
We live on Catford Heath, so that's literally down the road from Poole, and having to have a 20-minute ride in order to get, medical help, I think it's ridiculous.
Bournemouth Hospital casualty unit is overrun already, and the ambulances are queuing up outside there. So if they close the unit at Poole, it will only be more overcrowded, and people's lives are at risk, really.
Well, with me now is Debbie Fleming, who is Chief Executive of both Poole Hospital and Bournemouth Hospital. Debbie, have you still got a bit of a public relations job to do to convince people that your plan is the best plan?
So we have done an awful lot of work already to engage with local people to talk about these changes, but I think we all recognise they're very ambitious changes, so we need to do a lot more to address the outstanding concerns, to really explain what we're doing, and to work with people about what a big improvement this will be for locals.
Can you guarantee, can you promise that things will be better in the future?
All of us are about wanting to improve services for patients. I mean, many of us local residents, we live in the area, we use the services ourselves. We want to work with people to make things better. That's why we're doing this.
Have you future-proofed the plans, because demand is only going to go on increasing?
So when we started the work, we were looking and projecting ahead, and obviously all the time we're looking at what's happening with demand. Demand is very, very challenging for people. Our plans are good plans about trying to act early to try and prevent people having to come to hospital, and when they do, to get them home as quickly as we can afterwards.
Will there be upheavals in terms of reorganising all these services?
We're fortunate, we've got 5 to 6 years before we actually see major change in the shift of services, but our teams are working on that now. Our clinicians, our doctors and nurses and other professionals are regularly working together to look at how we can work better now to meet the needs of our patients, and so we've got a bit of time to work through the detail.
Debbie Fleming, thank you very much indeed. And from the Royal Bournemouth Hospital, back to you, Sally.
Steve, thanks very much.